Skills Care Practical Approaches Toolkit showcases successful models addressing adult social care challenges. This toolkit is aimed at system-level organisations, including local authorities, integrated care boards, chambers of commerce and others. It looks at how to bring adult social care providers more meaningfully into local or national planning discussions. The insights come from work that was led by Kent Invicta Chamber of Commerce, who are the employer representative body for Kent and Medway. As the convener of employers, training providers and partners for the local skills improvement plans, the Chamber made a deliberate choice to recognise adult social care as a standalone sector. In Kent and Medway, providers are operating within a fragmented landscape, facing intense workforce pressures and struggling to have their voice heard within broader health and care conversations. National issues like turnover, limited career pathways and low visibility of social care roles were felt even more sharply at a local level. It was clear that a focused, sector-specific engagement model was needed. Working with skills care, local authorities and trusted networks, the Chamber developed a structured approach that enabled adult social care providers to articulate the skills that matter the most, directly shaping local workforce priorities. The Chamber of Commerce built its approach around one simple idea: adult social care needed its own protected space to talk about its priorities. To reach providers meaningfully, the Chamber worked through trusted sources such as registered manager networks, learning and development groups and local authority channels. This helped providers to feel confident that the work was relevant and worth their time to be involved. A key part of the approach was employer-only discovery sessions, which created space for honest, unfiltered insight about the skills that the sector needed. These were supported by roundtable discussions, cross-sector events and an engaging skills conference that helped build relationships and raise the sector's profile. Several things strengthened the approach. The Chamber focused on delivering a small amount of meaningful insight rather than overwhelming providers with surveys. They also chose formats that encouraged open discussion using familiar venues and tailored breakout session discussions. Finally, providers could clearly see how their contributions helped to shape priorities, actions and investment, which built trust and kept people engaged. The approach made social care a clear LSIP priority, boosted provider involvement and increased the sector's visibility. Colleges adopted employer-led activities and providers felt more confident because they could see their insight directly shaping decisions, actions and future plans. The Chamber of Commerce began by making a clear case for change and planning activity around providers' limited time, so engagement felt focused and manageable. They removed practical barriers by covering small costs, using familiar venues and choosing formats that encouraged open conversation. Strong partnerships were essential. Skills care and local authorities acted as trusted intermediaries, helping the changer reach the right people and keep the work rooted in real frontline experience. Engagement centred on those who knew workforce challenges firsthand, and early sessions were kept provider only to support honest discussion. The Chamber also put firm governance in place. Advisory panels tested assumptions, aligned work with local strategies and ensured feedback-shaped decisions. This visible feedback loop built trust and kept providers involved. The result was stronger relationships, better insight, more responsive training provision and a clearer voice for adult social care in local skills planning. For those wishing to replicate some or all of this approach, here are some further recommendations. Engage providers early with simple evidence and clear reasons for why their input matters. Make involvement easy by avoiding peak periods and offering short, flexible sessions. Keep your governance simple, using light touch oversight and regular short progress updates. Build repeatable routines such as recurring sessions and shared resources that support longer term engagement. And encourage cross-sector learning and share practical examples that providers can adopt. The Practical Approach Toolkit is available to download from the Skills Care website. The toolkit includes a short overview with key takeaways, a detailed walkthrough of the approach and each step of the process, and practical recommendations for anybody wanting to develop a similar model in their own area.